How long can the average penis stay erect? When it comes to erections, penises can be incredibly finicky. Sometimes, when you want more than anything to maintain an erection, say, when you're in the middle of having sex with someone you really like, you can't stay hard. Then, when you really don't want to be hard, say, in the middle of a big presentation at work, your body will decide it's the perfect time to pop a boner. The unpredictability can be really frustrating, so it's no surprise that you have questions about how long the average penis can stay erect and more. To better understand why our erections do and do not work the way we always want them to, we reached to two urologists, Michael Ingber, MD, a urologist and urogynecologist at Garden State Urology, and Lawrence Levine, MD, a professor of urology at Rush University Medical Center in Chicago and director of the Medical Advisory Board for Promescent. The penis doctors helped shed light on how long the average erection lasts, what may be inhibiting your erection, what to do if your erection lasts for longer than 4 hours, and how to reduce your refractory period between sexual encounters. How long does an average erection last? Erections can last from a few minutes to about half an hour under normal circumstances, Levine explains. PDE5 inhibitors, like Viagra or Cialis, can extend the duration of an erection in some men in addition to making it harder. Studies have shown that a normal man will ejaculate within 3 to 7 minutes with continuous stimulation. So if a man wants to last longer, they need to change up the stimulation by changing positions or taking a break from direct stimulation, Levine says. Typically, erections will subside after ejaculation as a man enters what is known as the refractory period or the inability to obtain an erection directly following ejaculation. What are some individual factors that may decrease your erection duration? The primary erection busters that can affect obtaining as well as maintaining an erection are diabetes, high blood pressure, elevated cholesterol, and smoking, Levine says. These things accelerate the aging of the tiny blood vessels in the penis. Excessive alcohol use, prescription medications, and illicit drug use can also contribute to your erection not lasting as long as you'd like. Why do you sometimes lose your erection during sex, even when you're turned on? This is often due to mental factors like anxiety, depression, and stress. Our term for younger people who have normal anatomy and blood flow who can't maintain or obtain an erection is called psychogenic erectile dysfunction. Ingber says. We frequently work hand in hand with a mental health specialist to help these patients. Levine adds that physical issues that lead to poor overall health could inhibit erections during intimacy. These may include underlying health conditions like diabetes or hypertension, low testosterone, or injury, specifically to the nervous system. That said, far and away, the most common cause of losing an erection during sex after obtaining a strong erection is a change in the level of arousal, he says. If you're not turned on by something that's happening in the bedroom, be honest with your partner. Say something like, "I don't think this is working for me. Can we try this or this?" Mutual masturbation could be a good option too. What are ways to increase the length of time you have an erection? Probably the most important thing a man can do to help his erections is to stay healthy, get regular exercise, watch your diet, don't smoke, and control the intake of alcohol, because too much booze can cause whiskey dick, Levine says. Why do you lose your erection after you ejaculate? This has to do with the way the nervous system works, Ingber explains. It's a complicated system that scientists still don't know everything about, but we know that when the parasympathetic nervous system is excited and activated during sexual arousal, nitric oxide is released, and this dilates the blood vessels to the penis, allowing increased blood flow and erection, Ingber says. Following intercourse or arousal, the sympathetic nervous system activates, which causes seminal emission, ejaculation. This results in the return of blood flow out of the penis, causing detumescence, getting soft. What are ways to reduce your refractory period? As we age, our refractory period increases, i.e., it takes longer to get hard again after you ejaculate. A person in their early 20s may have a refractory period of 10 to 15 minutes, while a person in their 60s may have to wait 12 to 24 hours before being able to gain an erection, Levine says. PDE5 inhibitors like Viagra and Cialis are known to shorten the refractory period to regaining an erection, decreasing the so-called bounce-back time. But they don't change the time to have another orgasm reliably. What happens if you have an erection for too long? Priapism, the medical term for a prolonged erection of the penis, is a dangerous medical emergency that requires urgent attention. You need to go to an emergency room or contact your doctor immediately if you have an erection that lasts longer than 4 hours. Priapism can happen after ingestion of one of our medical therapies, such as Viagra, or sometimes can be a result of side effects of antidepressants or antipsychotic medications, Ingber says. Some patients with sickle cell disease are also more prone to this problem too. How do doctors treat priapism? Erections that last much longer than 4 hours can cause permanent scarring and erectile dysfunction where men are no longer able to obtain an erection, Ingber says. Typically, the treatment for this involves injecting medicine directly into the penis to reverse the effects of the erection. And in more rare cases, surgery needs to be done to shunt the blood flow away from the penis.